Dr. Elnahal, thank you very much again for joining us. I wonder if we talk about the issues around Omicron, should we be as fearful right now about Omicron as we were about previous variants, including Delta?
Thanks so much for having me. There's definitely still cause for concern, although recent news in the last couple of days have made us a little bit more optimistic. So I'll go into reasons why to be concerned first. We have a virus that's spreading extremely fast throughout South Africa and now Europe, and we don't even know the extent of spread yet in the United States. We know that it's in over 17 states at this point, and that list keeps growing. And so even if you have a virus that's less severe, it may end up still impacting hospital capacity when more vulnerable older people get it. Remember that the first case of COVID was in early January 2020. The first death wasn't documented in the US until late February of 2020. And so we really have to, and I'm sorry, across the world, not the United States. And so this is really important because we don't know exactly what the relative impact will be of severity versus spread. However, it's very encouraging that yesterday Pfizer showed us that 3 doses of their vaccine does multiply antibodies that are specific to Omicron. So that leads us to believe we should absolutely boost. And at least so far, it does appear that it may be less severe than previous variants. So it's all about a balance of these factors.
All right, so I mean, the caveats, let's stipulate to the caveats. It's very early on. We all know that there's not a lot of data information available on Omicron, but that the indications right now are that they're possibly less severe. You mentioned hospital capacity. Is there really a threat that we could be overrun hospital-wise, even though there's a large segment of this population already vaccinated, despite the fact that there is still ongoing concern about those who are unvaccinated?
I think the probability of that is still low, especially in areas that are highly vaccinated, like the New York metro area, New Jersey, where we are. However, it's really impossible to rule it out at this point because we just don't know the propensity of this virus to spread. Remember that the spread of the virus is actually the #1 indicator on whether you'll have hospital admissions and whether you'll have deaths. And without knowing how this virus impacts, for example, older, more frail folks, especially in nursing homes, we won't know exactly what it will do to hospital capacity. However, we're much better at this now than we were in the spring of 2020. We have surge plans, we have therapeutics on the horizon, and we just have a more immunized population at baseline to COVID-19 viruses, all of which should help.
I mean, again, before we let you go, there's also a feeling out there that, and maybe some evidence to support it as well, that the COVID is going to be something that we kind of deal with or have to live with, so to speak, on a regular basis, much like the common cold or the flu. Is that your sense? I mean, is this going to be something where I get a shot every year because I would just want to kind of keep the flu at bay, just like I want to keep COVID at bay?
That may very well be the case. In fact, that's been how pandemics and epidemics have ended almost universally in the past. You end up getting a virus that ends up being less severe, may spread through communities and populations. But with the advent of vaccines, which we already have, and therapeutics, we essentially learn to live with it. It will cause some morbidity every year, but it certainly wouldn't fill our hospitals, and it certainly wouldn't be cause for public health emergencies on a sustainable basis. The idea is that we can control it and that we have the tools as a healthcare system to deal with it.